Good morning, good afternoon, good evening. It depends upon when you're listening. We're so glad you're here, and we're glad that we're here because we're going to welcome you to the solution. Nothing changes if we change nothing. We are the New York City Prevention Resource Center. We're housed at Children's Aid. We're funded by New York State OASAS, the Office of Addiction Services and Support. And I'm Ronni Katz, and this is...
Chevar to the Francis. I'm the co-host of the solution. Like, again, nothing changes if we change nothing. I'm excited, man. You know, this is our second podcast. What season is this? We haven't even broke down the season sets yet. So,
where are we? Who are we? It's the fall.
It is the fall. I'm excited. I'm excited about what's happening today. I'm not sure if I should say what's happening today because they won't see this audio until after. But I do, or see the video and hear the audio. Let me get that correct. But I do want to have that conversation in a later podcast and bring people in to talk about the special event. I was just say it. There's a town hall happening.
Yeah, I mean, it'll already have happened, but it'll be available on recording, so it lives on. If you missed it, you'll get to see it. So why don't we tell them what this town hall is about?
And the town hall is about, I want to make sure I say this correctly, it's more about cannabis awareness and educating people about it. Not an introduction to or saying go out and use, more of an educational piece on one part is about legal versus license, and also how it may or may not affect young people. I'm talking about cannabis in general. And Ronnie, please help me out as I'm looking through my notes to find out the actual definition.
Well, it's called Can We Talk About Cannabis? And it also talks about limiting access for young people to cannabis through retail, licensed retail and unlicensed retail. So it's just going to look at this as a community and see what different stakeholders think about it. And there's some really great guests on the panel. And it's just going to be an introductory talk to get people talking about this issue. Because we know that through the eyes of prevention, we need to set up barriers so that young people do not have as much access to cannabis. And this is the first in what will be many, probably. Mm-hmm. And it's tonight. It's through NYC POP, the New York City Partners of Prevention, which is a SOAR-funded coalition through OASIS. And we're really excited because they're doing something really big. And our fairly new community development specialist for NYC POP, who actually was on our podcast last summer, Fatma Sintu, and I hope I said her last name right. She's been putting it together with the committee, and this is not a one-person situation. This is a committee stepping up to work together and talk about community. It's going to represent so many sections of the community. So we will keep you posted, and we'll make sure that you have the link to it as far as seeing it again, because once you hear this, it'll already have happened and we'll all be celebrating.
Yeah, I want to clarify the date is in, because we both said tonight, the date that we're referring to, again, is what we recorded Wednesday, October 23rd, starting at 6 p.m., ending at 8 p.m. So when you hear this, it would have already been done. But like Ronnie said, we will have a recording available so everyone can participate in that recording, whether you will ask questions that will be in the comments, and we'll have Fatima and NYC POP respond to those comments at a later date.
There you have it in a nutshell. Yeah. And what we're doing today is very relevant, and we're not going to say how, but yes, our guests today are going to kind of connect all those dots for you. But how are you enjoying the fall so far?
I mean, you know why I'm laughing, because it's been warm.
Yeah.
It's been extremely warm, so you know me, I'm happy. I know everyone else isn't, but I'm happy. I'm extremely happy that the warmth is there. I'm a summer baby, and I believe this upcoming weekend the clock will go back, and we'll get less sunlight. Is it this week?
No, it's after Halloween. I remember years ago when they made it so that it wouldn't happen till after, so that young people out there trick-or-treating would have some a little more light in the afternoons. Because a lot of the young ones go out after school.
And I think that's a rare idea. I'm glad that I'm wrong. It's happening this weekend. Because as a former trick-or-treater myself, going out in the dark wasn't the most fun thing to do, especially living in the city. But when I'm saying it wasn't safe, it was just dark and scary. Because when you're a kid, everything at night is scary. Especially during Halloween time, where you have all the horror films and so forth. And, And then thinking about stories as a child, even moving forward to now, I think we covered this in some of our NYC pop posts about not absolute, but the possibility of drugs or paraphernalia being put inside of young people's candies. But that's not always the truth. And there are small cases that it does happen. But I would say to any parent, please, make sure you go through your candy, the kids' candy,
Yeah, I mean, it's rare.
Very rare, yeah.
But like you said, but sometimes things happen, and no matter what, you always want to check your kids' candy, and you also want to eat some of it.
Oh, absolutely. Katz.
I remember, it was a long time ago when I was trick-or-treating, and I grew up in Bayside and Whitestone, and it was pretty safe in those neighborhoods to trick-or-treat at night. And I'd go out with my older brother and his friends and come back with we used to use pillowcases, and I would have these pillowcases filled with candy. And my mother always took on the job of dividing it up into the jars. Now, my mother loved candy. I was the house that had, we had the candy cabinet in my house. So when my friends would come over, they knew that cabinet over the sink, if you opened it up, you found all kinds of candy, because my mother loved her chocolate. So I know that she kind of skimmed off the top, but it's okay. We wound up having so much, we never ate it all. But jars, big giant jars of it for months.
That skimming is called the parent tax. And it's totally fine.
Exactly.
It's called the parent tax.
That's right. Exactly.
or the guardian tax. And everyone has a parent. They have the adult tax or the supervisory tax. And that's totally fine, because, hey, we need sugar also. There's nothing wrong. Another one, a little bit of sugar.
I try to avoid sugar as much as possible, but once in a while, I have to indulge.
I mean, this is the time of the year when you do.
That's right. I haven't bought my Halloween candy yet because I'm afraid to have it in the house.
For me, growing up, we had tons of candy, but we didn't always eat it. It would just sometimes sit there because, we would get all the candy. We're going to eat this. And then, months later, I'm like, oh, this candy's there, and I don't want this. So, for me, even as a dad, we're taking my kids trick-or-treating, and they wouldn't eat it. And then I would find mounds of candy under their beds or melted chocolate.
No.
It's under the pillow. I'm like, don't sleep with the candy.
Well, you've indicated that you like your Kit Kats.
Oh, I like the Kit Kats. I mean, those I took. That was the dad tax. The Kit Kats were the dad tax.
Well, yeah. My mother used to take the Milky Ways. Anyway, I see that we have people at our door. And this time I was talking.
Oh, yes.
So why don't we let them in?
Absolutely.
And we'll welcome our guests. All right, so Chevar's going to let them in. And they're about to appear, so we'll let them get in, and then we're going to have them introduce themselves.
Why they come in, Ronnie? What was your favorite candy?
I always liked the Milky Ways a lot.
Okay.
And years ago, Chunkies were very popular.
So your mom did a mom tax on your favorite candy?
Well, I liked them all. I like the Hershey's. We're talking about Halloween candy. But we have two guests.
And the parent tax. Before we start, do you do a parent tax or an adult tax on candy that comes in your house from your children, from any kid? No. Well, not yet, maybe.
Is that the same thing as a tariff?
Yeah.
I'm not going there. Okay. What we were just having a crazy discussion, but we'd love for you to introduce yourself. So
rather reintroduce yourselves. You've been here before, right?
That's true.
Yes, I have. A couple of years ago now, I think.
Yeah.
Thanks for having us again.
Thank you. Thanks for coming. So for those who don't know who you are, please tell us who you wonderful two people are.
Go ahead, Jessica.
Sure. So good morning or good afternoon, whenever you tend to watch this. My name is Jessica Boylan. I am a project director from Coordinated Behavioral Care, located in downtown Manhattan. Chris?
Oh, that's it. Hi, Chris Copeland. I'm a consultant working with Jessica, helping to shepherd this network, Citywide Addiction Support Network, over the last few years. So great to be here for the first time.
Yeah, this is Chris's first time.
That's right. Jessica came.
Yeah, we had Carol Ann last time with me.
The irony of that is like Chris, we did the Xylazine, the 3 parts. Chris was in the background helping, getting our guests. So I totally thought you were here, but you were in
Yeah.
every email.
In spirit, but not in person. Though. Yeah.
So you were in every email. So I apologize, but thank you for coming on
course.
to our podcast in the Citywide. This so you might hear CASN, and that's what Chris was referring to earlier. So Rhonda, you want to ask the first question, or should I ask the first?
Sure. You know, we were just talking about the town hall tonight, which is actually directly connected because there's a New York City pop event to CASN. That's the other way it said CASN. So yeah, if you guys could describe CASN for our listeners and our viewers, tell them what it is. What are those odd letters that go together?
Sure. I'll take this one, Chris. So CASN or CASN stands for Citywide Addiction Support Network. So Chris and I lead this network. It is a collaboration of 20 nonprofit agencies across 3 of our 5 boroughs. So across Queens, Bronx, and Manhattan, stemming together the 20 nonprofit agencies, partnering with New York City Health and Hospitals. It was formed back in the beginning of 2021, so we're almost into our 4th year. It, the funding comes from the state opioid response grant. So really, we're here to combat the epidemic, working with those, suffering from opioid and stimulant use disorders. We have, when we're fully hired, so that's a plug for some vacancies out there. We have upwards of 78 peers with lived, they're in recovery with lived experience, and a handful of prevention facilitators as well. So we really work in those 3 boroughs, bringing prevention, treatment, recovery, and harm reduction services, in the streets, different parks, hotspots where we see a lot of people using. We work alongside a ton of different schools, places of worship, different clinics in the hospitals, and really just trying to network and bring this, some much needed services to the city.
Jessica, you just said something like I always practice as a listener, or Chris, either one of you can answer this question because you described the community, right? You said schools, faith places, all these different places. So if I'm an agency, or I'm Chevar's greatest agency in the world, and I need support, what would that look like? How can I get in contact with you? Or what support should you give me? What would the dialogue be like between you guys and my agency to push forward or to get the support from each other? Either one of you guys can answer that.
So it would look like what you wanted it to be. I think there's a huge. Maybe it's worth describing. There's been a shift in philosophy around treatment or support for people with substance abuse, and it shifted to a harm reduction model that really tries to make sure we're providing what people want when they want it, rather than pushing solutions on people. So you as an individual or you as an agency were wanting support, our peers would be there to give you support in any way that it could be. And it may have nothing to do with your actual use of substances. It could be to do with housing, clothing, food, shelter, safe use kits, etc., wound care. And we can go into, what we're dealing with on the streets in a little while and why we've been so effective, but we would try to match whatever your need is. The prevention specialists actually use evidence-based. They use a couple of evidence-based practices, and I think Jessica, you can say more about them. But that's very much tailored towards schools and other communities where we can try to provide primary prevention. But the rest of the service we provide wherever people need it. And, we're in the courts, we're on the streets, and we're in recovery and treatment facilities as well. So, it's a very broad answer. And we can get more specific if you want, but it's really about tailoring the support to what people are looking for.
Sorry, yeah, Ronnie, go for it.
Yeah, that's been the impressive thing to me, that it isn't just like a one size fits all. And, very often in the past, there were very few choices, but I've been impressed the fact that somebody who's in need, say, of Suboxone in the middle of the night, someone will, meet them and bring it to them. It's just amazing to me. And if some of our listeners are wondering, how does NYC Pot fit into this? Because they focus on things other than opioids. It's about starting prevention early so people don't progress to that stage. So I just wanted to tie that in there because it's been remarkable how all three pillars, I guess, or towers who have, been silos for so many years are working together. I call it coming under the same tent.
Right.
And we're just, there for each other. And it's really been remarkable to see this grow. So I just wanted to put that out there.
Yeah, the important part of the work we do is providing access to Medicaid-assisted treatment 24/7, both by Samaritan Daytop and health and hospitals provide that service. So that what you mentioned, Ronnie, in terms of somebody needing something in the middle of the night or over the weekends, we can provide that, maybe in person, maybe virtually, but the peers are available to try to make sure somebody who's wanting treatment or services can actually get there. We were at Lincoln Hospital this week talking with the emergency room about how the peers that work for us could be the warm handoff from the emergency room to a treatment facility. Actually walk them there or take them via transportation, so people are less likely to find other things to do on the way, which is obviously a huge temptation for somebody leaving an emergency room after maybe an overdose. So the peers, and we can't say enough about the peers. I mean, I think at some point during this discussion, we really want to give a huge shout out to the peers who.
Oh, we can do that now because you said we said peers about 37 times.
Yeah.
And for those of us who are listening, what exactly is a peer? What do they do? Give them the flowers. Give them a shout out. Explain to the listeners and the viewers, like, a peer, my friends, or is someone across the street? What is a peer? Give us a definition. Give them their flowers. Shout them out.
Okay.
The heroes walking the streets of New York City and working in this network. They've come against their own, issues and, with drugs and alcohol at a certain point in their lives. And they're now like giving back to the community, and they're upfront with, like what Chris mentioned, their own temptation, and, self-care is very important, and education and training. But, we emphasize the network and the collaboration because they support each other. They're just a remarkable group of people. And we've had the luxury of, meeting with them over the summer several times, hosting annual barbecues and getting, all the peers with their experience, and also our prevention facilitators with their experience coming together. It's those are the good days. Chris and I always say those are our best days.
No, the best time. Yeah, we help facilitate. I mean, I think we just opened up a Zoom call for the peers to meet with each other every 2 weeks. So I think that's sort of a highlight of our time, is spending an hour with a group of people who are both so dedicated to try to making connections and fighting their own recovery at the same time. It's a remarkable experience. I mean, I think Jessica used the word heroes, and I think we really feel that they are our heroes, because in many ways they're putting their life on the line every time they go out, because they're meeting with people who are using the same drugs they used to use in the same neighborhoods they used to use them in. So that is a huge risk factor for them, and the more support we can provide as possible. But that singular definition of these are people who have lived experience of using the drugs or alcohol that people are now fighting, and that's the sort of key case. These folks, that they've been there, done that, and they use that experience as a way of connecting in a way that very, very few other people can. Certainly, I'm a social worker in background, but I could never connect with people in the way that they can.
Yeah, and think about it. We've been seeing a decline. I mean, it's a small decline, but for the first time in years, in 4 years, I think, we saw, I believe, a 1% decline in overdose fatalities in New York City. And I have to believe this is, one of the reasons, or if not the reason. Yes, there are way too many people who are overdosing, but at least we're starting to see it now go in a different direction. For a long time, we didn't.
Yeah. And the number of Narcan kits that we've given out is in the thousands. And each month we're giving out hundreds and hundreds of Narcan kits and Xylazine test strips and fentanyl test strips into the thousands. So they must be getting into people's hands who are using them at some point. And I think that's testing the drugs to make sure they're safe, and having the Narcan kits available if somebody does overdose is critical. And as they say, their sort of primary job is to keep people alive long enough to begin to think about treatment or reduction in the amount of the drugs they're using. Remarkable group.
So it's safe to say that these peers are allowed to add a new chapter to their lives and to tell their story in a different way. So if you are individuals out there who may be struggling and you're willing to, or you're ready to change, this is a possibility. Whether it's a peer here or anywhere in life, there's an opportunity for you to add another chapter to your life. So with that said, because that's an amazing accomplishment. So can we add to what are some of the other, or in addition to it? I want to say other. In addition to, what are the biggest, the other accomplishments? The other, some people might think minuscule, but they're large. Although like Ronnie said 1%, 1% is still big, right? To make change. What are other large or accomplishments that people might not know, or people do know of? Please share.
Sure. Jessica, we haven't practiced, so we never know who's going to
Yeah.
Well, I think one of the major accomplishments of this grant has been creating what we're now calling a professional workforce, the peers. When we first started 4 years ago, and previous to that, I think a lot of agencies or a lot of people didn't really know what peers could do. These are somebody maybe who took somebody to, gave them transported somebody, or went somewhere, or got some clothing for somebody. But now we really begin to recognize this workforce as a professional link in the chain of services for people. And I think that in of itself is a really major achievement, that now that these folks being recognized for really what their value in terms of using their lived experience and beginning to understand this professional role being quite different from clinical roles, and how do they differ, and what the importance of that. So that's huge. And one of the things that they did, this group, the peers that we work with, first alerted us to the threat of Xylazine on the streets. Before Oasis did, before the city did, before OMH did, before Oasis did, they said, we've heard about Xylazine on the streets and we need to do something about it. And they were the ones that said, we've got to put on education. They're the ones that pushed the network and the agencies to put on community education events. We had one in Queens, one in Bronx, and one in Manhattan last year, and we repeated the same this year. And they were the ones that pushed for Xylazine test strips to be available. SAMHSA wouldn't allow it as an expense to begin with, so it was their advocacy that got the Xylazine test strips into our hands when it first started, and really pushed that education. So developing this workforce that now recognized as having their own professional status, and the rest of the organizations being listened to by them. They're the ones that educated the clinicians and the leaders of the agencies. They're the ones that hosted the Zoom call to say, this is what Xylazine is, this is how we need to work with it, this is how we need to treat the wounds. They're the one that educated everybody else. So that for me is, if nothing else comes of this network, I think that's been a huge accomplishment and a piece to be very proud of within this network.
I think I just want to add one more thing, with that. We have been fortunate to be able to utilize their education and expertise, and they've been willing to train other providers or other teams of, let's say, maybe case managers or social workers even, on what they're seeing in the streets and what their knowledge is around Xylazine. So they've presented, and Chris and I were there as well to help facilitate a little bit, but at a recovery conference last year, and just great feedback, and just the support from the community and what they're bringing to the rest of the agencies that may not be part of this network is great as well.
Well, I know that, we learned the most about Xylazine from all of you and from the peers. We barely had heard of it. It's funny because, it's not funny, but I mean, it's I think the day before, my wife came to the door while I was working and said, "Look, I just watched a video from another state about this stuff called Xylazine." And I said, "What do you mean?" A trank. She said, "It's called trank. Have you heard of it?" And I said, "No, I haven't really." And I looked it up, and the next day we had the conversation about raising awareness. So they were really ahead of the curve. And we did, for those of you who remember, we did a 3-part series on Xylazine. And I think we should revisit where it's at now and look at some new trends. So I'm curious, are we hearing about some new substances out there? I've been getting some alerts, but I'm curious to see what they're seeing, because they see it first.
Yeah, we've heard about, I know I'm going to say this wrong, but medetomidine, which is a stronger animal tranquilizer hitting the streets, and also carfentanil, which is 100 times stronger than fentanyl, believe it or not, are a sort of a new wave of drugs that we may be dealing with. Jessica and I met with a sister agency from Philadelphia, which seems to be the epicenter of where these drug changes are taking place. And what they've found, they saw Xylazine 5 years ago. We saw it just over a year ago. So that their drug supply seems to change before ours. But the frightening part of that was, what we were being told was, there's very little fentanyl left in the drug supply now. It's nearly all Xylazine and increasingly medetomidine. So people are now not addicted to the opioids. They're addicted to this new strain, these tranquilizers, which means quite a different intervention. And unfortunately, what they were telling us was, because the fentanyl is so small within the Xylazine supply, that if it increases dramatically within that supply, people can overdose because they've lost their tolerance to fentanyl. So they're seeing lots and lots of fentanyl overdoses of quite small amounts because of the lack of tolerance to it. So, I mean, I think, as we go forward with this network, we need to be thinking about how do we gear up for quite a different approach to this drug supply. I mean, it's not, if it goes the way of Philadelphia, then it's not necessarily about opioids. It's about these major tranquilizers, and how do we deal with that? And quite a scary vision for the future from Philadelphia. It's awful.
I remember when fentanyl first was being heard about, and I was working in Maine for public health, and I had something called the Overdose Prevention Project, and that was about 13, 14 years ago, probably. And they kept talking about it in Chicago and Philadelphia. And that's what we're hearing. They kept saying, yeah, but it's not here in the Northeast. It's not here in the Northeast. And we started to hear about it in small amounts. And by the time I got back to New York in 2014, it was starting to really take off. And at the time, very often funding and prevention is several years behind the trends. You get funded for something and you kind of have to make your deliverables around that. And then there's another problem here. So we saw the state and the city really jump on that. And start to look at it. But how do you keep up? I mean, just talking about this, I've heard some of the stuff you're saying, and you got to wonder, how do you keep up with it? I mean, you can't really. But so you mentioned readapting the model and looking at things differently. So that takes us into what I'm curious your vision is for the network moving forward, because now we're in the the fourth year of the contract, and then there's going to be hopefully a new contract. Fingers crossed. But what's the vision you both have and the network has to be able to tackle these things?
Well, I mean, one of the first questions I guess we've got to answer is, if the drug supply moves away from opioids, how do we adapt the funding, which is for opioid and stimulant use? So part of the question we've got to answer, I think, when we're looking at the extension of this, continuation of this grant, is how do we use the money that we have to combat quite a different drug supply. So that's sort of part of what we're going to need to be dealing with over the next few months. But I think we've got to partner more with medical. Clearly, what we were seeing in Philadelphia was a lot of damage done by Xylazine and increasingly methamphetamine in terms of sores, necrosis, etc. So I think we need to have a stronger input around medical support with the peers, so they have some sense of how to deal more effectively with it. And if the continuation of this is not really about seeking treatment, it's about keeping people alive, we need to make sure that really we're concentrating on that. It's interesting that there is not a huge take-up for Medicaid-assisted treatment. So we need to make sure that we're focused in the right area. Jessica, you can obviously...
Yeah, no, I mean, I agree with all that, and, just continuing to increase education. And I think just, creating the platforms to share what we're seeing out there, because if it wasn't for, that support meeting that we run, we wouldn't have probably been at the forefront in hearing about Xylazine and made, strides as fast as we did. So, ensuring that we're continuing to do that, and definitely linking up more with medical staff, and perhaps looking at, further drug testing here, and how do we link that, what we're seeing on the streets and in the different boroughs to our agencies that are part of this network and who has the best resources. So, that's also another thought for the future.
Yeah, we really do need to understand the makeup of the drug supply. I think that's a really good point, Jessica, in terms of trying to test the supply to make sure that we actually know what's going on and keep abreast of it. I don't know there's a lot of testing going on, so if there is, we don't know about it, and we need to find out more. I mean, it would be good to, I think, strengthen the career path for the peers as well, because we've got a lot of people coming in as peers who are newly clean, have been through some basic training, and are working on the streets immediately and making sure they have the right support, right supervision, but also thinking about a career path, because some of the people leave to become CASN. That's CASN's others, isn't it? The CASAC. Thank you, CASAC and case managers. So it would be, if the funding would allow us to build in some sort of career path for them, I think that would be valuable as well, because their experiences are again remarkable. It's strengthening everything we do. We're in the courts in Queens and Manhattan and Bronx, strengthening those connections, strengthening the discharge from Rikers, I think, is important. We have a staff member who's part of the Pride Center for Health and Hospitals, and trying to make that connection stronger between the services they provide for the LGBTQ community and the rest of the network. So continue to strengthen those interrelationships between prevention and recovery treatment and harm reduction. I think we've got an enormous amount of good collaboration and goodwill amongst the providers that we can continue to build on.
I'm sitting here listening, and I have a totally different question. And we sent you guys questions, but I have a totally different question, because I'm
You're not supposed to give that up.
Well, hey. I can hear the compassion and concern in your voices, and I can see it in your faces, right? And I want to ask, and this is a little bit personal, and if you don't want to, you don't have to answer, but it's not that hard. It's not that hard of a question. What made you all get into this work, and why do you stay? I was sorry, did I stump?
No.
This is I hear because I want to be very honest. I'm listening and I'm watching. I'm like, wow, you guys really care.
I'm long in the tooth. I've been doing this a long time. I've been a social worker 40 odd years now, I guess, and I fell into it to begin with. But it was, if I hadn't been a social worker, I would have been a teacher in a community college or whatever. I mean, or an attorney doing civil rights work or something. So, social work's one vehicle, I think, for making sure that the luck in my life, as many people as possible can share in that sort of advantages and looks. When I'm asked that, I often say both my grandparents were coal miners in the north of England, and I've moved from within 2 generations to being able to live anywhere in the world, and my son lives in New York and do whatever he wants. So I mean that is important to me, and I wish everybody else had those chances. So this is a way of doing it. And to be honest, I bet I'm not going to say, I can't guess what Jessica's going to say, but this passion comes from working with the peers. Plain and simple. I mean, their infectiousness in terms of the work they do is really what you're seeing shining through me anyway. I gave you a chance to think.
Oh, thank you, Chris. Yeah. I think the city's huge. There's so many providers. There's so many agencies. We're kind of inundated in a lot, right? It's connecting and kind of breaking down the silos, breaking down the walls to kind of grow, and create a team that's, fostering and working towards the same goal. That's the biggest thing for me. I've had experience at different nonprofits across the city and Long Island, and even within each agency, you have different sections and programs and silos. And so, working on this network and bringing, 20 plus agencies from all over that specialize in, what they specialize in. And it's been pretty remarkable to see, and I look forward to, what's to come, being part of something like this, and seeing it develop and evolve, because, like everything, it takes some time. So seeing where we are now compared to where we were 2 years ago, I mean, is huge. So that's it for me.
Yeah, it's just so moving, and I've also been observing for the last couple of years, and I've seen you both get more entrenched in it and more passionate about it, and just as I'm sitting here thinking, like, we hear a lot about the treatment and recovery types of things going on, the harm reduction, and people may be saying, well, how does primary prevention fit into that? And I'm thinking how we always talk about a continuum, and it's the first stop on the continuum, because we don't want people to have to get to the end of the continuum. But if they're there, it's great to know that there's ways to serve those people and take care of them too. It's it's kind of circular at times. So I'm just curious, how do you see primary prevention even fitting into all of this?
I feel like prevention is now at the table, at the forefront too, and they've grown tremendously. The agencies and the providers that we have, with that experience, linking them to, they've gone out on outreach with some of our, our treatment teams and our recovery teams, and, bringing their expertise to, the public schools and to also to parents. So just, real quick, we, they deliver 2 evidence-based practices, Triple P, which is a positive parenting program, as well as SSET or SET, and it's support for students exposed to trauma. So those are the 2 that they are delivering right now, like I said, to families, to youth in schools and clinics. We do foresee perhaps maybe some changes if the network continues, and, maybe a continuation of, service delivery and training for parents and families. But the linkages that they've created and the collaboration, like I mentioned, I do think that they're at the front of the table as well, alongside the treatment and recovery providers.
You know, one of the prevention agencies that was represented at our meeting with Lincoln Hospital yesterday, and was talking about how do they provide their prevention services within the hospital setting. So there's a way of accessing, people who may not normally stumble across prevention services. So including them in those sort of meetings opens up pathways for them to do that sort of work as well.
I want to say thank you. It is a lot. I have a ton of questions to ask and to get asked. I know we have a limited amount of time, and I should have saved that other question for part 2 of this discussion, because we do want you all to come back. But I do want to do a deeper dive into who, if allowed, to who you are and why, to get a stronger explanation. You guys give a great explanation, but also because again, I said I see the compassion, I can see it in your eyes. I can hear it in your voice, the concern. It's there, and I'm pretty sure it's going to be conveyed to the audience, to the listeners. But like I said, we're running out of time, and we normally do have a question. I'm not sure what question. We have a closing question. I'm not sure the question that Jessica answered last time. But I'm going to change it up in the sake of you all came into hearing us talk about candy and Halloween. What is your favorite child, if you partook in Halloween as a child, or if you just ate candy as a child, what was that one candy that you had to have and why? Or 2 candies. And why do you think I'll go? Right? Kit Kat, number 1. Kit Kat, well, there's 3 candies. Kit Kat, number one. Whatchamacallit, because it's the funniest name, and for those, I'm giving my age away. Whatchamacallit is a candy that none of you all know anymore. And the last is Reese's Buttercups, because you can put the little wrapper in your mouth and make believe you had no teeth. I'm not sure if anyone else did that as a child, but I did that. I walked around with no teeth in my mouth. I'm like, oh my God, he has no teeth. Blah, blah, blah. But what are the what is that candy that whether it was Halloween or just as a child that stuck with you, that if you see it right now, oh my God, it's nostalgic for you?
Did I say Rolos?
Okay. Why Rolos?
You just got me at, like, if you see it, you're like, oh yeah. So I'm definitely picking that. And the mini Twix, because the big Twix is just too much, right? The little mini, perfect bite size.
The caramel or caramel, however you say it, it's a bit. You're 100% correct.
So for me, because my childhood was in England, were something called wine gums. There's no wine in them at all.
Okay.
Right. But they're like the very, very hard gummies. And they have like port or wine or something written on the top of them. But he always used to get them in little paper bags. They had a big jar of them, and he used to ask for a quarter of a pound or a half pound. And then whoever was behind the counter would get a little paper bag and scoop them in and weigh them out. So that's me. Luckily, can't buy them in this country, so I don't eat them all.
Luckily.
Chris, did you go trick-or-treating? Like, is that a thing there? No? Okay.
Mischief night, I think, was the... I don't think we remember trick-or-treating, but I think kids used to go on mischief night.
Mischief night. So there's a whole other discussion.
I think we got that here, too.
Yeah, I want to hear more about that.
I do it, too.
But I'm also thinking, we'll reach out to you, too, to get any kind of, like, information or links so that people listening or viewing want to get in touch with somebody, with one of the peers or one of the agencies, how they can do that. So we'll reach out for those contacts. So I just want to show everybody that'll be in the description when we release the podcast. But you got me thinking about candy now, but it definitely, I think my mother loved the Milky Ways, but so did I, because we used to put them in the freezer. Yeah. And then you break your teeth. I'm talking about breaking your teeth. But anything chocolate, just give it to me, and I'm still, that's my thing, my chocolate.
The best way to eat a Twix is frozen. Yeah. If you want to eat the large size Twix, freeze them.
Well, thank you both for coming on. I'm thinking about how much has been done just over the few years that we worked with you. And, it's also relevant. And hopefully maybe we can do like a catch up with some of our guests from the Xylazine series just to see what they've been seeing. And it's opened my eyes. We see a lot more people around our office. And now we, at least for now, we know what's going on. We started to see very different reactions. But I fear at this point, it's some of the new stuff as well. We've seen some really desperate people,
Right.
I guess I need to know, and maybe we'll bring this up at the next meeting, is what we can do around our office, because we're starting to see, I've called, 911 and ambulances have come, but people need more than that. So that's something I'd love to talk about at the next, CASN network meeting, so we could find out, those of us around the city, how we can access the services within our own workplace or surrounding it.
Mhm.
We always forget to ask about that.
Yeah, no, we'd love to do that. Yeah, it's a great idea. Yeah.
All right. Well,
Thank
Chevar,
you for inviting us.
Yes, thank you.
A pleasure.
We'll be sure to share the 24/7 hotline number. We have an intake email address that anyone can, reach out to share, if they need support themselves, vacancies, if they want to be part of this network, etc. So we'll be sure to send all that information over.
offhand, I don't want to put you on the spot, but do you know the 24/7 hotline number in case anybody listening doesn't have access to the links?
Not off the top of my head.
That's okay.
We're gonna flash it on the screen really big. Don't worry.
We will make sure
Carolyn hears this, she's gonna be like,
it takes a village. We'll have some more people from the village on soon. Thank you both for joining us.
Pleasure. Take care. Goodbye.
so much. See you
Bye-bye.
soon.
All right. Happy Halloween. Almost.
That was cool. That was very informative. Scary too. Like Chris was sharing these two to three new iterations or evolution. I don't want to say evolution, but with like the next level of drug, 10 times is more potent as fentanyl. I'm going to screw the name up, so I'm not going to say it. The other animal tranquilizer. I'm like, it's scary. I mean, for me at least, but it's but informative.
Yeah. That's terrifying.
But informative. Very, very informative.
But
Go ahead. I'm sorry.
the good news is that we have people working the streets and
Mm-hmm.
really trying to make a difference. And, so it's scary and it's sad. There's a lot of good people out there who want to help make a difference and keep people alive. And whether they get into recovery or not, that's going to be the path. That'll be up to them. But let's at least try to save some lives. And again, prevention starts it all, and we run the whole continuum.
Hey, everyone. This is the solution. Nothing changes if we change nothing.
See you next time.
Oh.